Okay. Which of the following is the most appropriate initial pharmacological treatment for his rheumatoid arthritis? A 50-year-old man with a history of rheumatoid arthritis presents with a progressive shortness of breath and dry cough. A high resolution HRCT scan demonstrates interstitial lung disease. Which of the following is the most appropriate initial pharmacological treatment for his rheumatoid arthritis? Okay, I think a couple of these can be used for rheumatoid arthritis, like NSAIDs, tumor TNF alpha, methotrexate for sure can. And so I would immediately get rid of methotrexate because that can exacerbate his interstitial lung disease. Um, I'm actually kind of torn here. I feel I'm gonna go with TNF alpha inhibitors. That's exactly what I would go with, but it very well could be NSAIDs just because of just like, oh yeah, but I mean this dude's had a history of it. I would go with this.
Okay, so let's talk about
Ooh.
this here. Okay, rheumatoid arthritis, interstitial lung disease. It is important to choose a DMARD, which you were kind of thinking of, has a lower risk of exacerbating ILDs. Hydroxychloroquine is a DMARD with relatively low pulmonary toxicity and is an appropriate initial pharmacologic. But let's look at this. Methotrexate, right? But it's associated with pulmonary toxicity, so you're correct there. Infliximab is a TNF alpha, right?
Ooh, I should have seen that.
But it can make the interstitial lung disease can be a little bit worse, but also they have two, right? They also, you remember, infliximab is also a TNF alpha inhibitor, so they both can't be the correct answer, right, on test taking strategies. And then NSAID, right, it's not strong enough, right? And NSAID is just, it's like ibuprofen, right? And so you want to definitely, kind of use something that's a little bit more strong. So
Cool.
all right. But like I said, going back, as you already know, this type of question is not fair for step two. But the way you work through it, you have way adequate enough knowledge to answer this question on a step two basis. They'll never ask something like this. The way they'll ask this question for rheumatoid arthritis is which one of these medications can be used to treat rheumatoid arthritis, and they'll probably only give you two answer choices that treat rheumatoid arthritis. One that causes, pulmonary fibrosis, like for instance methotrexate, and number two, maybe it's a hydroxychloroquine or TNF alpha, one or the other. They're not going to make you choose between every single treatment that is applicable for rheumatoid arthritis. That's more of a step two question. So.
Okay. Well, I've missed both of them already, so we're on a slow start for step two.
No, it's all good. It's all